All right. Good morning, everyone. I'd like to call the July Connector Board meeting to order, please. We have I feel like this is like a business meeting today. We have a couple of votes and issues items to review for the board to consider voting on. And we have several sets of minutes to review as well. So is there an agenda to be put up on this board?
I don't know that we have one at the ready to project, but Erin, if you were on, if that's not too tricky to pull up.
If you can pull it up,
I can do that. One
that'd
moment.
be great.
Thank you.
All right, thank you. So we're going to do this, as we all know, we're all very used to these kind of meetings by now. So if I could please have, and I guess I need to do these singularly since there may not have been some people at some of these board meetings. So I think what I'd like to first do is ask for approval of the meeting minutes from March of 2022, which seems like a lifetime ago, I'm sure, to everybody. So may I have a motion, please?
So
Thank you. I heard Dimitri, and who was the second?
second.
Thank you. All right. Are there any changes, revisions to these minutes? If not, I would ask for Kathy to do the roll.
Good morning, everyone. Martha,
Yes.
Michael,
Yes.
Elaine,
Yes.
Cassandra,
I'll abstain.
Keisha,
Yes.
Dimitri,
Yes.
Secretary,
Yes.
Nancy,
Good morning, Kathy. Yes.
morning, Matt,
Yes.
Rena.
Yes.
Thank you.
Okay. So we're going to do the same things for the meeting minutes of June 2022, please. Is there a motion, please?
So moved.
Thank you, Dimitri.
Seconded.
Thank you. All right. Are there any changes or revisions? If not, may I have the call, Kathy, and of course, good morning.
Good morning. Martha, did I lose Martha? I'll come back. Michael,
Yes.
Elaine,
Yes.
Cassandra,
Yes.
Keisha,
Yes.
Dimitri,
Yes.
Secretary,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena,
Yes.
and Martha.
Yes.
Okay, thank you, everyone.
All right. Thank you, Kathy. All right. So obviously it's July. We will be reviewing the plan year health and dental plan conditional seal of approval, and then the budget, as well as a presentation on outreach and communication marketing and the procurement. So with that, I'm going to turn it over to Audrey and company. Morning, Audrey.
Wonderful. Thank you so much. Good morning, Secretary. So for the seal of approval presentation, I will actually hand it over to Maria and Sam.
Great. Thank you, Audrey. Excuse me, and good morning, everyone. So today's seal of approval presentation represents the midpoint in the seal of approval process after sharing the proposed 2023 product and policy requirements with the board at the March meeting. Today, we'll provide a summary of the seal of approval submissions received from carriers before returning before the board in September for the final seal of approval presentation following completion of the plan year 2023 rate review process. As a reminder, the key items carriers addressed in their SOA submissions, the 2023 SOA requirements are guided by the Health Connector's strategic plan and health equity priorities. The product shelf requirements reflect a desire for stability within minimal cost sharing updates required annually to keep pace with the federal actuarial value calculator in addition to enhancements of PPO plan offerings on Health Connector for Business. In the Connector Care program, carriers must set cost sharing for certain medications for select chronic conditions to $0, and all carriers must work with the Health Connector toward participation in the Connector Care program in 2024. The 2023 SOA requires carriers to continue aligning with the EHS Behavioral Health Roadmap and sought narrative responses on health equity topics for future policy consideration that we'll review in a later slide. So unless any preliminary questions, I'll turn it over to Sam to discuss the product and carrier changes expected for the 2023 plan year.
Just pause. Anybody? We're just going to keep. All right.
Okay, thanks, Maria, and good morning. I'll begin with an overview of changes to 2023 qualified health plans. The Health Connector received responses from 8 medical carriers for the 2023 seal of approval. These 8 carriers submitted a total of 45 non-group plans and 57 small group plans. Standard plan offerings on Platinum, High Gold, High Silver, and Bronze Metallic tiers represent the majority of plans offered on the non-group and small group product shelves. A non-standard low gold design within a prescribed actuarial value range is also available on both shelves. On the small group shelf, a standard low silver HSA compatible plan design is available, as well as PPO offerings based on the gold and silver standard plan designs. There are 3 carrier branding changes for 2023, which we will highlight here and discuss further in forthcoming slides. As referenced in our March presentation, Tufts and Harvard Pilgrim are merging at a corporate level to Point32 Health. While new and existing Tufts Direct and Harvard Pilgrim members will remain within the same respective issuers, the Tufts Premiere issuer will no longer be available, and existing members will be mapped to a Harvard Pilgrim plan within the same metallic tier in 2023. Always Health Partners will rebrand to Mass General Brigham Health Plan for OE 2023, and Boston Medical Center Health Net Plan will rebrand to WellSense Health Plan. This chart on slide 6 outlines the 45 non-group QHPs proposed for the Health Connector's consideration for open enrollment. There's a net decrease of 7 plans for this year, mainly as a result of the closing Tufts Premiere plans. And this chart on slide 7 outlines the 57 small group QHPs for consideration, and there's also a net decrease of 7 plans. In these next 2 slides, we provide further detail about new and closing plans for 2023, as well as details about carrier changes. So beginning with new plan offerings, United will offer a new standard gold HMO plan on the small group shelf, and this brings the issuer into compliance with our plan parity rule for PPO products. Moving to Tufts Premiere, there are 5 Tufts Premiere plans closing for this open enrollment. And beginning in January 1, Tufts Premiere will no longer offer plans on and off exchange. All on exchange members will be renewed into analogous Harvard Pilgrim plans within the same metallic tiers and very similar networks. This change will not impact Tufts Direct membership. Tufts Direct will continue the current unsubsidized APTC only Connector Care and small group offerings. Both Tufts Direct and Harvard Pilgrim will maintain the same branding in 2023, despite being part of the larger Point32 Health company. We have 2 additional plan closures for this open enrollment. On both product shelves, Tufts Direct will close their non-standard bronze plan, and members will be mapped to a standard bronze plan design. And on the non-group shelf, H&E has requested to waive their catastrophic plan offering for 2023. H&E's existing eligible members would be automatically renewed into the lowest cost catastrophic plan available to them. Blue Cross, yes, Rena, I see you have a question.
You can finish the slide, Sam, and then I'll ask my question. Go ahead.
Sure. Blue Cross and Tufts Direct will continue to offer catastrophic plans in 2023, whilst the remaining carriers submitted requests to waive this offering. Given sufficient choice and availability offered to eligible members, we recommend granting all catastrophic plan waivers. Moving to other carrier changes, Always Health Partners, as mentioned, will become Mass General Brigham Health Plan, and BMC Health Net Plan will be renamed WellSense Health Plan. In both of these instances, these changes reflect updates to carriers' names, plan names, and logos in our shopping system, but these changes will not impact the issuer's existing on-exchange product portfolios. Health Connector staff are working with the carriers on communication plans to mitigate member confusion associated with these changes. And yeah, happy to take questions now.
So Sam, I just want to make sure I'm understanding what's going on with point 32. So it sounds like what you're saying is that the Tufts plans and the Harvard Pilgrim plans are going to continue to be offered in the broadest market under those existing brands, but because they're a combined entity for connector purposes, they can choose to just offer one set of plans with the full network. I'm just trying to understand how they're still operating under different brands and what kind of products are still being offered.
Sure. So current state, we have Tufts Direct, which is our connected care carrier, which also offers, unsubsidized plans. We also have Tufts Premiere, which is just unsubsidized APTC only. So and we have Harvard Pilgrim. So we have 3 at this time. And then with open enrollment, the Tufts Premiere, unsubsidized APTC only plans, that membership will be mapped into the Harvard Pilgrim product. So they'll retain the Tufts Direct, connector care, subsidized product portfolio, and Tufts Premiere will become the Harvard Pilgrim product portfolio.
So let me ask the question a little bit differently, and maybe this is a question for the Division of Insurance instead. I'm just trying to understand if they've got if they're still operating under separate brands, how it is that they're not both required to still continue to offer their plans on the connector. And it's more just a curiosity question than anything else.
Sure, I would defer to colleagues on that question if you're able to answer.
I think the way that the division has understood this sort of change is the process of merging Tufts and Harvard Pilgrim into one entity, point 32. So these plans would be offered under point 32, but as you may know, there are both entities have multiple licenses.
Mm-hmm.
And so it looks like they are mapping some of the Tufts plans over to the Harvard Pilgrim plans to operate under that license. So it's not necessarily branding, it would be under the point 32 brand is my understanding.
Okay.
Yeah, that's,
Oh,
go ahead.
go ahead.
Secretary.
No. Please go ahead, Sam.
Sure. I just wanted to mention that in this plan year, the brands will look alike. They won't look like a point 32 company, meaning those logos won't change. Their plan names will remain as they are now. So they'll retain the existing brands this year.
Yeah, thank you.
This open
Sorry.
enrollment.
Just wanted to indicate that this is part of their process of moving over into the point 32 name, which is what's been communicated to us.
Got it.
The migration. Nancy?
And then when there are new requirements year after next, the contract year, to participate in connector care, what will the entity be at point 32 that will be required, or the entity or entities that will be required to contract with connector care?
So we touch upon this a little later in the presentation, but at the higher level, so Tufts Direct will remain the same, and then it's our intent that either Harvard Pilgrim or point 32 company, whatever is existing at the subsequent open enrollment will participate.
Okay, great. Can I ask another question? Because that wasn't why I put my hand up. Sam, you said
Yes.
that the They're very similar networks between Tufts Premiere and HPHC. Like, can you say a little bit more about what you
How
mean by that?
analogous?
Yeah, how similar?
Sure. Yeah. So we have a high level overlap right now. I can provide an example too. So for acute care hospitals, which is a little easier to track, the Harvard Pilgrim network is actually slightly more expansive than Tufts Premiere. So they cover every hospital in the state, whereas Tufts Premiere, or acute care hospital, Tufts Premiere covers almost every hospital. I think there's a couple of exceptions. We did receive some summary information, and we're waiting for kind of more detailed information from the Point32 teams. But at the high level, there was very limited disruption, like mismatches between Tufts and Harvard networks. And they mentioned that was for both medical and behavioral health providers. And they also referenced that in instances where providers were not contracted with Harvard Pilgrim right now, that they were working on those contracts and working on continuity of care plans and would provide that information to us.
And then of course, although we're going to map them to the HPHC products, anyone is free to change to a different carrier if they want to.
Right.
Yeah. Okay.
So that brought me to the end of my slide. So up next, Marie's going to address some of the quality and value initiatives and connector care program design and dental product offerings.
Sure. Excuse me. Thank you, Sam. Sam, if you don't mind just muting your line before I proceed, that would be great. Thank you. All right, so the 2023 SOA prioritized certain health equity initiatives and invited carrier responses on a range of topics to inform future SOA policies. And we welcome board feedback and suggestions as we consider ways we can make improvements in these areas. In the connector care program, as previously mentioned, carriers will be required to set cost sharing to $0 for medications associated with the treatment of diabetes, hypertension, coronary artery disease, and asthma, and carrier submissions reflect adherence to this initiative. On the topic of maternal health, carriers described a range of strategies to improve prenatal and postnatal care, and while doula coverage is not yet common in Qhps, it remains an area of interest for a future seal of approval. The Health Connector also remains committed to exploring ways to advance transgender health and gender-affirming care, and carriers indicated they have care management team expertise on staff, as well as transgender health advisory groups in existence or in progress. All right, and moving on to the connector care program, while staff will provide a more detailed connector care analysis at the September meeting following premium rate review, carriers' SOA submissions allow us to review carrier participation, geographic coverage, and provider network changes for the upcoming year. The same 5 carriers will continue offering connector care plans in 2023, though with 2 changes in geographic coverage. Allen Health will expand to cover Middlesex County in full, while Health New England will withdraw its coverage of Worcester County. We're working closely with HNE as we approach open enrollment to assess member impact, particularly as it relates to provider network offerings. HNE's Worcester County members would be renewed automatically into the lowest cost connector care plan available to them in 2023, though they would have the opportunity to change plans according to their price and network preferences. Additionally, the 2023 SOA included requirements that all carriers work toward entering the connector care program in 2024, and we're working with the new entrants on implementation and onboarding plans, and will continue to do so throughout 2022 and 2023. So any questions before we move on to a brief overview of dental?
Anybody?
Yeah, I have a brief question. This is Matt. On the doula coverage, you can remind me what the SOA questions were. Did we seek through the SOA to understand doula coverage? Did we leave open the possibility that coverage for doula services could be more consistent and robust across the plans? It seems that we've identified this for future discussion, and I'm interested to know whether it was whether anything more was contemplated other than kind of understanding the range of options here. And this is an area where the GIC is also interested in exploring some coverage changes within the health equity framework, and I'd be curious to hear a little bit more about where the SOA review led us as it relates to doula coverage.
And before the connector answers, Matt, it's Mary Lou. So we are adding doula coverage in the Mass Health program, and happy to share with you the survey information and other information from the field that we use to put together the coverage in the Mass Health program, if that would be helpful. Happy to share.
That would be very helpful. Thank you.
Yep. All right, I'll turn it over to the connector. Sorry.
Thank you, Secretary. And no, that's a perfect beginning, because I was going to piggyback on that, which is that the Health Connector is tracking the Mass Health and statewide efforts to move in this direction. So the question, and I'm happy to share it after the meeting, the specific question that we asked, but we were seeking to learn more from carriers about where they are at this point to see kind of what we can do to bridge the gap and to make sure that we're aligning as much as possible and as early as possible with the work that's going on at the statewide level. So we asked about doula coverage, standalone coverage versus coverage if they're part of an inpatient visit and things like that. And we also did ask about, broader efforts to improve prenatal and postnatal care. So I guess the answer to your question is both, but we're definitely tracking those other agency efforts. And this was part of kind of information gathering to make sure that we're aware where the carriers stand so that we can move forward for a future year.
Excellent. That's helpful. Thank you. And we've done a similar process through our procurement for plans for FY24.
Oh, great.
And I'll have someone connect with you, Matt.
Thank you.
Yep, no, thank you. All right, Nancy?
Thanks. Could you just give us a little brief more flavor of this? Were we impressed with where the carriers stood on these matters? Did we see best practices? Do we think we have a lot of work to do? Like, what was the sort of gestalt in each of these areas?
Sure. I would say overall, yes, although it's sort of dependent. And I would also say too, this is just a sampling of some of the questions we asked. We did have a longer list, but these were sort of the top areas that we sought information on. So I would say yes, kind of, to be honest, Nancy. And there was a lot of consistency, which was good. There seemed to be a lot of focus on prenatal and postnatal care and thinking outside the box in terms of adherence to those, offering social supports and transportation and things like that. So that came up in a few areas. Also noted on here, because it did come up from a few carriers, is the importance of linking to care for postpartum depression. And kind of bridging that gap. So we did see that in a few responses, which was encouraging. And on the transgender health piece, we know the Division of Insurance has been doing a lot of work in that area too. So I think a lot of the responses that we've seen were consistent with what we've heard and what we saw before in a request for information that we put out last winter. And, we were pleased to see that I think nearly all carriers, if they didn't already have some sort of advisory group, they indicated that they're in process of creating one and kind of going out into the community, making sure that, they're getting representation from a lot of different groups. So I would say the responses were overall robust and gave us a lot to work with for future policies.
Great. Thanks, Maria.
Sure. No, thank you.
Keisha?
I just wanted to share, thank you, Maria. It's very encouraging that when I hear you talk about the postpartum piece as it relates to the maternal health, because I think with many plans that is an area of concern and gap, quite frankly, in terms of coverage. So I'm really happy that the Health Connector used this as part of their screening. Is there any way as well, I would just be curious, and I apologize if I missed it in the previous slide, to also understand the level of options for mental health?
I don't think you missed it.
Sure, Keisha, and just to clarify, you mean as it relates to maternal health care or just the responses and kind of what was included in the SOA for this year related to behavioral health?
Correct. What was included in the SOA specific to mental health? With,
Sure.
obviously being a huge focus now in our world.
Yeah, no, absolutely. I would say our key things were to continue alignment with the EHS behavioral health roadmap, and that included a couple of pieces. One was to clarify that carriers do need to cover recovery coaches in any settings where they are operating. So that was kind of more of a clarification and making sure that carriers understand that we're kind of tracking that and making sure that those services are available to Health Connector members. Another thing that we've been tracking then that was in the SOA is the requirement that carriers contract with the community behavioral health centers as soon as those are kind of stood up. So we've been tracking that. We understand that there have been some recent updates there. So we'll be working with the carriers to make sure that they are moving in that direction to make sure that CBHC coverage is available to Health Connector members as well. So those were kind of the two key components in this year's seal of approval.
And this is the secretary. And so just to clarify, 25 organizations were designated as community behavioral health centers last week. They go live in early January, and that includes 24/7 immediate clinical access, as well as the ability to mobilize 24/7 mobile crisis capacity. So really,
That is super great to hear. Thank you so much.
I'm happy to send the announcement that also links to the website to the connector staff to send out, if that would be helpful.
That would be super helpful. Thanks
Yep.
so much, Secretary.
Because if I do it, I'll forget somebody, so I'll just send it to staff. And scheduling and email groups apparently is not part of my portfolio these days. So we'll do that. Matt, your hand still up or?
Yes, Secretary, thank you. And just briefly on the CBHC work, we also are through our procurement for FY24 moving in the same direction as the connector is here as well. My comment here was about there seems to be, well, there is quite a bit of rebranding of carriers this year, more than we have seen in past years. That is, of course, also the case for us at the GIC. I'm sure the connector will have high in its list on the communications front, making clear what those changes mean to members. It just occurs to me that there will be, the potential for some confusion or lack of clarity on the part of those who are seeking to enroll or re-enroll. So just wanted to flag that as something that I'm hoping and confident that we'll put some effort into on the communication side.
Sure. No, thank you. Absolutely. We're working closely with the three carriers on those. And I think to your point, it's especially key because it means something a little bit different depending on the carrier. We have the two that are just making purely branding changes, and then we have the migration of Tufts Premiere to Harvard Pilgrim. So the messaging will certainly be a little bit different, and we're working with the carriers on communications plans.
Nancy?
Yeah, I also just wanted to say that I assume that we are continuing to make sure that all the carriers are offering good access to the full range of reproductive health services, including abortions.
Yes, absolutely.
I would say is a high degree of focus on the full range of women's reproductive health care coverage and services in Massachusetts. And also ensuring we have capacity for late-term abortion, because I think that is going to be part of the additional concern with restrictions in other parts of the country.
Yep.
Since
Well, and thank you for your leadership on this, Secretary Suthers.
Yes, agreed. If I may as well, I know obviously that with the environment we're in, that the abortion piece is the big topic, but also contraceptive access is also another major part of that reproductive health. And so just really hopeful that everything that we're doing and what we're providing as part of our services also considers that contraceptive access. So for example, in Massachusetts, we have already within policy that women should be able to get contraceptive pills, for example, up to a 12-month supply. And I know that this has been an issue in some cases in terms of having that access, even though it is policy. So just truly hopeful that with the services we're offering, that these barriers do not exist with our plans.
So, Keisha, we're, in addition to messaging and whenever we hear that there are barriers, take real or perceived, respond. So if there are circumstances where you're hearing that, or if anyone is hearing that, I would welcome someone reaching out to my office because we're rather assertive in our response in a in educating folks as to what the implementation of the policy should be. So
Fantastic.
please,
Yeah, thanks so much.
Yeah, no, very important. All right, Matt, your hand's still up, or is this a new question?
It is. Sorry, maybe I should just leave it up.
No, that's fine.
Just a request of the staff. I'm interested in learning some more detail about the VBID strategy for the chronic condition medications as we head into our plan design process in the fall and early winter. This is on our mind as well. So I'd be interested to learn some more details about how you're administering this, which particular, how you're approaching each of these conditions would be helpful to me.
Sure, no, happy to do that. After the meeting, I can follow up with some materials if helpful on sort of how we arrived at the proposal and the specific medications associated. I'd be happy to share that. Thank you.
Thank you.
Please send them broadly around.
Sure.
Thank you.
I can do that. Thank you, Michael.
So before we go on to, before we go here, I want to go back to the question that Rena asked earlier. I think it was to Sam. I don't actually remember who you asked it to, but the question of whether the CCA portfolio requirements applies to the combined portfolio for point 32, or whether each of the subsidiary brands each have to comply with portfolio requirements. I just want to make sure, and maybe I was the only one who felt like a little muddled by the response, but I think it's just worth clarifying one more time, or maybe I'm the only one who needs to be clarified.
Sure. No, I don't think so. And I will give it a shot. So the answer is yes, the requirement does apply to all of the brands, but Tufts Premiere will no longer be an entity. It won't be, a license that's offering plans. So therefore, the requirement will apply to the remaining offerings, which are Harvard Pilgrim and Tufts Direct. So to answer the question about Connector Care, Harvard Pilgrim will be the new entity for the Connector Care program, if that makes sense. So I hope that helps clarify. I think the answer is yes, the requirement does apply, but Tufts Premiere will no longer be a carrier because everyone is being moved to the Harvard Pilgrim plan. So does that help clarify?
It doesn't, Maria. I'm sorry. Are Tufts Premiere plans going to be offered in the market going forward? Forget about the connector right now.
I don't believe so. I don't know if Martha would want to confirm that, but it's my understanding that no.
I'd have to go back and just check and see what our last briefing on this. We've been in regular contact with Point32 on their plans for how they're going to be applying each one of their licenses, but I just can't remember off the top of my head, but I'm happy to follow up with you.
Thanks. Because I mean, I think that's if Maria's comment about the Tufts Premiere license no longer issuing plans, then everything you said makes total sense. But if the license is still offering plans, then I think there's still the question of why they're not offered on the connector shelf. And I think if you can clarify that, I think everyone would understand. And it looks like Secretary Sutters is nodding her head. So I think that would answer the question for her as well.
Well, in fact, they'd be in violation potentially of the law.
I'm not trying to go there. I'm not trying to go there at all. I'm just asking for a clarifying question. Yeah.
Let's just clarify the question first.
Yes. Yeah.
Thanks.
Yeah, I will just offer, we can take that back. And Andrew, if you want to jump in anywhere, because any carrier with more than 5,000 lives in the merged market has to participate through the health connector. So I think what we're trying to describe here is we're seeing that Tufts Premiere license go away in the merged market, which implicates just Harvard Pilgrim as the connector obligated entity, if that makes sense.
That makes total sense.
Okay.
What you just said makes total sense. Yes.
Well, you sounded so much like a lawyer there, Audrey. It scares me.
I'm certainly not.
Right. Thank you. Thank you for indulging me and clarifying that.
Of course.
All right. On to oral health.
Okay, thank you. So on the dental side, there are no changes to 2023 dental product offerings. The same carriers intend to submit the same suite of plans for 2023, with Altus and Delta serving both non-group and small group membership.
Can you just go back? I'm sorry. Okay, sorry.
No, happy to take any questions.
So before we, obviously, this is an important part of our work together, the conditional seal of approval. But before we take the vote, I just want to see if there's any more comments, questions before we continue. Just want to, I don't always see hands up, so I'm just pausing here.
I just had one quick question with regard to the new low silver and low gold plans. Are we creating any confusion with regard to potential actual value differences between those plans is the new low gold sort of like a silver plan that's being put forth as a gold plan? What's the actuary value difference between low silver versus silver and low gold versus gold? And will the consumer be able to clearly delineate the differences?
Sure, thanks, Dimitri. Good question. So I'll start with low gold. That has actually been a product offering for several years now, and the actuarial value of those offerings historically had been around 76%. That is changing for 2023 due to federal changes in the allowed de minimis AV ranges. So this year, those low gold plans are required to be a little bit higher, around 78%. So the high gold plans, in order to create enough of a meaningful difference, like you're suggesting, between the low gold and high gold, our standard high gold is around between 81 and 82%. So there is a 4 percentage point difference between those two offerings, which we hope presents meaningful choice for members, in terms of variation. And then similarly on the low silver and high silver, the low silver standard design is right around 68%. And then the high design is close to the top of the allowed range at 72%. So similarly, we're hoping that those offer enough differential in plan design and associated premium that members have a choice and variety when they're shopping. So does that help answer your question?
Sure, but I wanted to make the question was really, as the consumer looks at the plans, can they tell the difference? Really is what I'm trying to get to.
Sure. So we have a few things that we try to support in that. We do have designated plan design names that we require to be associated with each. So we say, that all high silver plans have to have the name high silver in them and low silver. And then to supplement that, we do have various documentation and reference materials for members to kind of explain the differences between the plans, because we recognize that just the words high silver and low silver may not necessarily be meaningful. So we do sort of recognize that, it can certainly be confusing, and we have supplemental materials available on our website to kind of help with that.
Thank you.
I think really to drive Dimitri's point, I understand that we live in the world of these metals, but it is not common people speak. And I can tell you 7.5 years being on the connector board, I don't think in terms of silver, gold, bronze, except in a technical way. And it's really insurance is complicated enough, it's complex and complicated enough, even for those of us who live in this space. And making the plans offerings as clearly and cleanly accessible for individuals to make informed choices, I think is, just to reiterate, I think Dimitri's point is really important.
Sure. No, thank you. Appreciate that. And I was just going to add to one of your comments made me think of it, that we do add some tooltips to our website to help explain kind of what a metallic tier is, because to exactly what you're saying, that doesn't necessarily mean something to everyone who doesn't do this on a daily basis.
And I have to say, I asked the question because I sent someone to the connector to go look for coverage, and they were relatively confused in terms of what our offerings were. So I think clarification and clarity from the consumer perspective, and I think we often look at these things from the technical aspects, but we have to be consumer/use case friendly, so that when our consumers go to the website, they can clearly identify what they're looking for and whether or not they can afford it, and clearly understand the difference. And I think we've come far, but there's still some work that needs to be done on that front to ensure that we continue to be accessible to the consumer.
Sure. No, points well taken. Thank you for that.
Appreciate that. I second that, Dimitri.
Thank you.
All right.
Thank you.
Anybody else before we? All right. So we have a vote before us on the conditional seal of approval. May I ask for a motion, please?
Opposed.
Thank you, Dimitri. Is there a second?
Second.
All right, there's multiple seconds. I'm going to give it to Nancy. All right, so is there any more discussion before the board for this vote? All right, Kathy.
Okay, Martha,
Yes.
Michael,
Yes.
Elaine,
Yes.
Cassandra,
Yes.
Keisha,
Yes.
Dimitri,
Yes.
Secretary Setters,
Yes.
Nancy,
Yes, with kudos and thanks to the staff for all the work that's represented in getting to this point.
Matt,
Yes.
Rena.
Yes.
Thank you, everyone.
All right. All right. Next up is, I don't have the agenda in front of me.
You've got the budget next with Carrie and
Budget.
team.
Thank you.
Yes.
Good morning, everyone. Let me make sure I can share my screen.
Come on, Carrie, you can be livelier on a budget discussion.
I'm sorry, this presentation is probably not as exciting as the last, but in any case, I just want to confirm everybody can see the screen. Is that right? Okay, perfect. So good morning, Madam Secretary and members of the board. The purpose of this presentation is to review our fiscal year 22 budget projection for year end and present our recommendation to you for fiscal year 23 for a vote. So the primary assumption that forms the foundation of our budget projections is, of course, the public health emergency, or the PHE, and when this will expire, which, based on current federal guidance, is October 15th. Because of the protections afforded by the PHE, QHP eligible members currently remain in Mass Health, resulting in suppression of Health Connector membership. This has significant budget implications, and with each extension of the PHE, our administrative budget is unfavorably impacted. However, the Connector Care budget is favorably impacted due to reduced spending on state subsidies, which results in substantial savings to the Commonwealth Care Trust Fund, or CCTF for short. Since this board last approved the budget in July of 2021, the PHE has been extended from January 15th to October 15th, which we assume in our current budget projections. So to quickly touch on FY22, although it is $3 million favorable to the original budget, it still reflects a significant loss of $11.4 million, savings on certain expenses and and the timing of other activities, meaning we've shifted some into FY23, offset the negative impact that the PHE would otherwise have had on our FY22 budget. And then for FY23, it reflects completion of implementation activities associated with the American Rescue Plan, as well as our contact center and billing vendors. And it accounts for additional investments and outreach to support our members as the PHE ends. Additionally, fiscal year 23 reflects CCTF support consistent with prior years, pending board approval. We are recommending restoring CCTF funding for administrative operations back to $45 million, which is consistent with what we received from FY18 through FY21. This assumes that we utilize a portion of program budget savings to offset the unfavorable impact of the PHE on our administrative budget. And just lastly, for some context for the board, it is of course possible that the PHE is extended an additional 90 days to January 15th, but we won't know that until official federal guidance is available, which we expect would be around the mid-August timeframe. So for just some context, if the PHE were extended again to January, the impact on our admin budget would be unfavorable to current assumptions by $3 million, resulting in a break-even budget. As far as the programmatic budget or Connector Care budget is concerned, an additional 90-day extension would be favorable to current projections by about $27 million, which would of course result in further savings to the CCTF. So I will stop there with the intro, and I'll leave time for questions, but if there are none, Nooper, I'll pass it to Nooper and she can start review of FY22, but I'll pause there for a second.
Any questions before we continue? All right, keep going.
All right, thank you, Carrie. Good morning, Madam Secretary and members of the Health Connector Board. Relative to the enrollment estimates we provided last year, which is represented by the blue line on the chart, current estimates for FY22 reflect a 12% decrease. These enrollment projections reflect the extension of the PHE from January 15 to October 15, which resulted in reduced churn from Mass Health to Connector Care. Based on an October 15th end date, we expect membership movement will begin to occur in the second quarter of FY23. Are there any questions on enrollment before I move on to FY22 budget?
Anything?
Oh, thank you. Slide 5 details the FY22 budget update, and just to orient everyone with the first column of numbers representing the July 2021 board approved budget, the next column representing current estimates, and the last two columns representing the dollar and percentage variance to budget. When we presented to you in July of 21, we projected FY22 would end with a $14.7 million net loss as a result of savings on customer experience, outreach, and consulting expenses, as well as the timing of key projects that were delayed to FY23. Current estimates are favorable to budget by $3.3 million, which brings our projected net loss for FY22 to $11.4 million. And this loss will be funded by our reserves, so you'll see the impact in that line as well. Are there any questions on FY22 budget?
Can you just say a couple more words about how we were able to save nearly $5 million in the
Absolutely.
call center and enrollment?
Absolutely. So part of that is driven by enrollment. As we saw reduced membership as a result of the PHE, we see reduced carrier fee, but also reduced per member per month expenses for customer experience. The reason we have savings in this line, though, is in addition to those membership saving, we also have savings on pass-throughs, which are not influenced by the PHE impact to membership. So that's why we have a net savings in that line.
I'm not quite sure what you mean by pass-throughs in this context.
In this line, when we say pass-through, I mean is like software expenses and other non-membership driven expenses that inform customer experience.
So you're saying that we reduced spending on some of those items that are not volume or membership related. Is that what
Exactly.
you're saying? Yeah.
Yes. Thank you, Nancy.
And Nancy, I would just add noticing is a cost as well in this line item. So we pay for notices that come out of Softeon. So we're getting better and better with those estimates as time goes along, but they're somewhat difficult, challenging to project.
And could you remind us the like 30% savings in consulting and professional support compared to what we had projected? What were the major sources of that?
I'll let Newber answer that. Thank you.
Thank you. Yes, a big portion of those are timing. So you'll see some of those projects move to FY23. And then the rest are just savings based on actuals and some projects that were expected and budgeted originally that ended up not being realized.
Thanks.
Thank you.
Matt?
So my question is about the impact on reserves here. And I'm looking at the kind of towards the bottom, the net position and reserves line. So we're projecting a larger net loss and therefore a larger draw on reserves than turned out to be the case. Do I read this correctly that the draw on reserves notwithstanding, the overall balance in the reserves is actually increasing?
Yes. So one of the drivers of our reserve line is informed by where our reserves ended in FY21. So at the time of our board presentation last year, FY21 was not finalized, so it was reflecting projected ending reserves. So that would explain the variance that you're seeing here.
And just for a little more detail, Matt, if it's helpful, we had some prior year accrual reversals that we needed to realize. I believe they were related to some of the costs we incur for Qhps operations and maintenance. So we did need to do that based on the audit, but we're happy to get you some additional information if you need it.
So with this variance, where do our reserves land at the end of the day? Once we tap the reserves to the degree proposed here, it's the 36 million that's net of our draws?
Yes, a non-GAAP 36 million, yes.
Got it. Thank you.
Thank you.
But Carrie, but then at the same time, there's the assessment that's ongoing, right? So like what, can you explain?
The puts and takes. I think.
Yeah, the puts and takes. I mean, I believe that has to be appropriated but like there's ongoing money through the CCTF assessment that's also, or not?
I'm sorry, maybe I'm not understanding your question when you say CCTF assessment.
Well, part of the original, there's a trust fund, as I understand it.
Yes.
That is, and I forget exactly who the assessment was put in anymore. It's been a long time, but I'll ask you the question offline. I don't understand I understand the that is the source of reserve for us. So when we have a budget
Oh,
loss, but there's also the larger context in which that CCTF exists.
yes. So as you know, we do not manage the CCTF. That's managed by ANF. But we do receive support from the CCTF for.
Which is usually like 35 million, but this last year it was less. So
it was 35 million last year. Previously, for the last 4 years, it had been 45 million. It dropped to 35. And then you'll see in the subsequent slide, we are respectfully requesting that we restore that back to 45. But if you have other, we can, yes, if there's other questions about the CCTF, we're happy to help you get those answered from.
Okay, it sounds like I just have to wait for the next slide and all will be revealed perhaps.
Okay.
Okay.
If your tobacco was definitely one of the things that was assessed for the original CCTF funding.
Are there any other questions on FY22?
We won't all guess when the PHE is.
I wish somebody had the answer sooner rather than later for all of our sakes.
My magic wand is missing from my desk.
Oh, okay, Nuber, I will pass it back to you. Thank you.
Thank you, Carrie. Thank you, everyone. So projected enrollment for FY23 reflects a 7% increase relative to FY22, largely for the connector care population. The primary driver of these projections is the ramp up in the second half of the fiscal year, assuming the public health emergency ends on October 15th. Are there any questions here before I move to FY23 budget?
Maybe keep going.
Thank you. So our budget recommendation for FY23 reflects a projected net gain of 3.2 million, again, assuming that the public health emergency ends on October 15th, and also assuming a CCTF transfer of 45 million, which is consistent with the support that we received from FY18 to FY21. FY23 is also informed by the completion of implementation activities associated with the American Rescue Plan and our contact center and billing vendors, offset by additional investments in outreach to support members as the PHE ends, strategic plan investments that were shifted from FY22, and the Simple Sign Up program. Are there any questions on FY23 budget?
I guess one question is if the PHE doesn't end,
yes,
what's the impact?
So the impact, Nancy, on our administrative budget, approximately an unfavorable $3 million. So the net position would essentially be break even. And on the connector care side, a 90-day extension would result in approximately $27 million net of FFP in savings to the CCTF.
Okay, thanks.
All right.
This is the last slide for FY23. So if there's no additional questions, we can proceed to the slide.
I think the earlier question about the CCTF and the administrative budget could basically be framed as, how do you feel about a negative administrative budget with a much greater increase in the CCTF? Because in some sense, there's a pool of money that's growing rapidly, even though our administrative reserves are going down. I don't know if that question made sense, but I think that was the spirit of what was being asked earlier. Was that right, Nancy?
Yeah, directionally.
Yeah, it sort of, this seems, actually, maybe you should just go to the vote because it's not going to affect what I vote. So I think I understand.
I do think, though, in a fall meeting, we have a meeting in October. It'll be clear it should be clear what's happening to PHE, that we should probably review the ins and outs of the CTF, if that would be helpful, or the projection of this.
Yeah, I think as we go along over the course of the next few months and we maybe have greater certainty, maybe we don't, just understanding a bit more about what the implications of delay or extension are in terms of what we're likely to be confronted with.
And maybe
20.
we need to have like an A&F meeting in October-ish, and we can go through it before a board meeting with our colleagues at A&F, a little bit more granularity. Cassandra, okay, Cassandra, we can, I think that probably would make some sense. Because I think there's a likelihood that the PHE will get extended.
Yep, agreed.
Thanks. All right, so why don't we do that? So we'll do an somebody, again, I don't do schedules, as we all know, because it would never happen. So I think we should probably plan on an A&F meeting before like a fall connector board meeting, and then we can sort of review the fund at that meeting. Why don't we do that?
Great.
All right. So I think we have a vote to accept the administrative budget as proposed. Is there a motion, please?
So moved.
Thank you, Dimitri. Is there a second?
Second.
I'm giving that one to Matt. All
I
right.
like when Cassandra seconds the budget for me, but was
All
that
right.
Cassandra?
Was that a Cassandra? All right, Cassandra gets the second. Kathy, you want to do the roll call, please?
I sure will.
Thank you.
Martha,
Yes.
Michael,
Yes.
Elaine,
Yes.
Cassandra,
Yes.
Keisha. I'll come back. Dimitri,
Yes.
Secretary Sutters,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena,
Yes.
and Keisha.
Mm,
Did we lose her?
I don't, she may have,
Maybe we lost her.
oh, no, she's still on, but why don't we can circle back with her.
Okay.
Great. All right.
Thank you.
Great. Thank you. The last item is the, to me, exciting. These are all very important topics of the outreach and communications marketing. And this is a procurement, I think. So let me turn it over to the marketing team. Jason,
Yep. Good morning, everyone.
came back from the Southwest or wherever you were.
Yes, it was wonderful. Thank you. We had
Welcome back.
an amazing time, and I did not die on Angel's Landing, so as you predicted. So feel good about that. I assume you guys can see my screen. Excellent, great. Thank you very much. Good morning, Madam Secretary, members of the board. I'm going to ask for a couple of approval on a couple of items today. This is our first go around on procurement since 6 years ago, and since then there's been some evolution in our approach in terms of marketing and outreach. Overall, we remain committed to reaching out to all the state's uninsured residents, and we are in the middle of working on a top-to-bottom review of all of our outreach and customer-facing activities throughout the agency. This process started in the winter, and as we started to consider the state of non-group outreach and marketing, it was right around the time when we needed to start thinking about this procurement. We realized we wanted to complete this review and not go through a full procurement this year without understanding what exactly our lessons learned and new needs are going forward. So we're going to be asking for a 1-year state blanket contract for non-group services. I should update this, sorry. And then next year, go through a full procurement to enable a partnership that fully meets our needs going forward. And then on the small group side, for the first time, we engaged in a procurement specifically for small group outreach and marketing services. Since our last all-encompassing procurement, we developed and launched the Health Connector for Business platform, and we've prioritized messaging to small businesses and brokers over the last 5 years. So on Health Connector for Business outreach and marketing since 2017, with the launch of Health Connector for Business and a focus on outreach to small businesses and brokers, we've seen a steady growth in enrollment and broker participation. We understand the importance of brokers in the market. We've dedicated outreach activities not only to engage with brokers to certify on the platform, but also use HCB for their clients. This there's some visibility involved on the outreach and marketing side, and then the HCB team has really done a great job over the last 5 years. Really one-on-one working with brokers, getting them to use the platform. Our paid marketing up till now has been driven through radio advertising for the most part. In recent years, we've run 2-month cycles leading up to the quarterly deadlines on Boston and Central Mass radio stations. We've also learned that search is the most used entryway to the platform, and we've kept paid search on year-round to lead those searching to Health Connector for Business. So in March, we launched a procurement. Through the procurement, we were looking for a partner that could handle all facets of outreach and marketing, from creating messaging to managing and monitoring the media buys. In particular, the team was focused on 2 areas. We wanted to see a clear understanding of Health Connector for Business, its role and value in the market, and understanding the needs of small businesses and brokers. And we wanted some help expanding and strengthening our partnerships with small businesses and broker organizations. This is another area where the HCP team has done a very nice job creating partnerships throughout the state, but we know there's room for us to get to the next level in that area going forward, and we want some help making those connections and building relationships on both the small business and broker side. So the terms of this contract would be similar to previous years, including the $1.2 million annual budget. The results of the procurement, we received 6 qualifying responses. The team selected Weber Shandwick, who's the incumbent. Their proposal displayed a strong narrative of understanding Health Connector for Business and the small group and broker markets, and they have a deep history of working with state exchanges, and they provided a plan for improving partnerships as we requested. So if there's any questions on that, I would be happy to answer. Otherwise,
let me just pause, see if there's any comments or questions. Dimitri?
Yes. Hi, Jason.
Hi, Dimitri.
Quick question for you. I know we've been working with Weber Shandwick for a while. Can we quantify some of the work that they have doing and some of the improvements that we have seen since we have engaged them?
Sure. So, we obviously we can talk about the changes in membership and brokers. I have a lot of data I can give you in terms of the media buy and how that's worked, the number of impressions and radio plays and all that stuff. I can certainly get that to you so you can see. And we review that with them regularly and make sure that platforms or maybe specific messages are working. And if they're not, we rattle some cages with the platforms and say, hey, this is underperforming, fix it. And if they don't, we move out of there and reallocate our resources to places we know are working.
Okay. For future references, it would be very helpful for me, at least, if we can incorporate some sort of report card or scorecard that really highlight some of the accomplishments from not just the qualifying, but quantifying in terms of what performance have been for some of the services and some of the vendors that we're engaging in that front.
Sure, be happy to do that.
I would also, and before I turn it over to the other questions, I think it also would be tying performance to outcomes in terms of expanded number of businesses, right, on the platforms or brokers using. I'm not sure what the metrics are you're using, right, but not just outputs, but like what the expectations are in terms of growth onto the platform. That would be mine. So let me turn it over to Nancy.
Yeah, just picking up on both of those comments. I think Dimitri is exactly right. The one metric of performance we do get in the monthly board report. And, I mentioned at my board briefing that the glass half full is that, membership is just about doubled since we went to the new platform, but the glass half empty is we have less than 12,000 members, which is a very, very small market share. So I think beyond Weber Shandwick's performance, and I'm very comfortable with approving this. I think at some board meeting, looking on a more overall basis at how we're doing in this small group market, how we think we can do, what the P&L looks like for this would be really, really helpful. Because, you know, notwithstanding everyone's very hard work at, you know, we have such a small footprint in this that I often wonder, should we really be in this market at all?
And just to pick up on Nancy's point, my view is very different from Nancy's, which is I strongly believe that we need to be in this market and in this space. There are definitely a lot of small organizations that don't have another place to go to provide insurance to their workers. And this is a wonderful program. And really, my question goes to, are we being as effective as we can be in terms of getting the word out with regard to the availability of the product? And are we using all the appropriate channels? Or do we need to look at the channels that we're currently using and find those that are least effective and not use them and go find those that are effective and put more energy into them? I don't think we should not be in the business of providing small businesses with the opportunity to offer their employees a product from the connector. This is.
I would say I'm a little bit more agnostic than you're characterizing my view, Dimitri, but one can't help but look at the national scene and see that the only two exchanges that have any significant small group membership are the two where they have a statutorily granted advantage in the market in the same way that we do in the connector care program. So I think there may be some other interventions beyond just channels and things that we should chat about.
Agreed.
Thanks. Anybody else? All right, we have a vote before us. Is there a motion?
So moved.
Thank you, Dimitri.
Seconded.
All right, Michael. All right, Kathy.
In quick here.
Okay. Martha,
Yes.
Michael,
Yes. Yes.
Elaine,
Yes.
thank you, Cassandra,
Yes.
Keisha,
Yes.
Dimitri,
Yes.
Secretary Settis,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena.
Yes.
Thank you.
All right.
Great, thank you, everyone. So then the other area obviously is non-group. As I said at the beginning, we continue to reach out to uninsured residents, including convincing long-term unenrolled to consider coverage, while also making sure that those newly eligible for coverage, whether they're moving into the state or some other reason, are new, know that we are ready and available to support their enrollment. Our focus is typically on open enrollment, but we ensure we have a steady stream of visibility throughout the year to make sure that when someone needs us, they're aware of the opportunities through the Health Connector. For example, right now we're running visibilities through sponsorship and participation at community events throughout the state. I think through the rest of the summer, we'll be making a push to folks who qualify for the special enrollment period under 150 federal poverty level, trying to get people in the door the best we can. But on the future of non-group, we came into this year, again, reviewing all of our facets of public-facing outreach with members and non-members. This review includes looking internally at how we interact with members and the public. We've had discussions with carriers, advocates, other stakeholders. We've created an evaluation metric to determine the strength of a particular outreach function. We continue to look at sort of considering who our target audiences are going forward. And with all that in mind, and that being developed at the same time as this procurement cycle was beginning, we thought it was prudent to complete this process, fully understand our needs and the policy playing field, and then seek out a partner that will help us realize those new goals and objectives going forward. So what we're asking today is to continue for one more year with ASG, which has been our non-group market vendor since 2016. Using a state blanket contract. ASG's experience in blanket pricing is competitive with the market as a whole. The The budget for this will be 1.1 million, which is consistent with recent years with ASG and non-group market.
I have a question. So when do you expect to have the staff review completed? I saw that the procurement would be early 23, but when do we think the review will be?
So I think we would start rolling that out right after New Year's and make sure by May we have the process completed and a vendor picked and be ready to go for July 1st of next year.
Any other questions before the vote? Seems like the prudent thing to do, right? Finish the review and then build it into the procurement process. The only thing I'm going to say is, procurements are meant to be really open and competitive. And while we have contracts with existing providers, we just need to really ensure that these are really, all of our procurements are really right to the full market. So it's a statement. Don't worry, Jason. I say it in every board I'm on. So, and to all my agency heads. So just
no problem. Thank you.
Yep. All right. So may I have a motion, please?
So moved.
Thank you, Matt. Second.
Seconded.
Thank you, Michael. All right. Kathy, the roll call.
Okay. Martha,
Yes.
Michael,
Yes.
Elaine.
I know Fellaine just had to hop off for something urgent, so she's
Okay. Thank you. Cassandra,
Yes.
Keisha,
Yes.
Dimitri,
Yes.
Secretary Setters,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena.
Yes.
Thank you.
Thank you. All right. Motion.
Thank you, everyone.
Thank you, Jason. All right, that concludes the formal business of the board. We don't meet generally in August, and we'll come back together in September, and then again work with staff on, I think, an A&F meeting sometime either in September or before the October board meeting. So is there any more business to come before the board or anything anybody wants to say? As I wind down, I'll probably have what, like 3 or 4 more meetings as chair. So.
We'll keep them exciting.
Somehow I think this fall will be exciting in ways perhaps none of us had even imagined.
We'll give you your insurance quiz at the end of it, just to be sure that you've mastered all the important concepts.
On high, low,
platinum,
metal,
gold,
and
yeah.
all the rest. Yeah,
Yeah.
Thanks. All right. If there's no further business before the board, and I wish all of you a good August, then may I have a motion to adjourn, please?
So moved.
Thank you.
Second.
Thank you, Dimitri. All right, Kathy.
Okay. Martha,
Yes.
Michael,
Yes.
Cassandra,
Yes.
Keisha. I'll come back. Dimitri,
Yes.
I skipped Elaine. Is she back?
I don't think so.
I don't think so.
Okay. Secretary Setters,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena,
Yes.
and I'll do Keisha again.
Yes, sorry, couldn't get off mute.
Okay. Thank you, everyone.
All right. With great appreciation to the staff for all the hard work and to all the board members. Really be safe, stay well, and I hope you get to take some time, take care of yourselves and your loved ones, and have a good summer. Take care, everybody. Bye.
You too.
Thanks,
Thank
everyone.
you.
Thank you.
Best wishes.